human life expectancy issues across the globe. Hey everyone, welcome to my channel. If you're new here, welcome, and consider subscribing to my channel and click that little bell notification below. Let's start with a question. Most of us, especially women, hesitate to answer. How old are you? And the next question no one dares to ask, and we never dare to think about is, how long do you expect to live? And what happens if you die young? And are we all gonna die young in the future? So in this video, you'll get answers for most of these questions and learn so much about human life expectancy issues around the world. Life expectancy, which is assumed based on statistical data and demographic factors, simply means the average number of years a person is expected to live. It's a measure of the average lifespan of a population and is often used to assess the overall health and well-being of a society. Life expectancy varies widely from one country to another, and can also differ among regions within a country. It can be influenced by cultural norms, government policies, and healthcare infrastructure. In general, developed countries tend to have higher life expectancies rather than less developed or lower-income countries. According to the United Nations Population Division estimates 2023, Hong Kong has the highest life expectancy, with residents living to an average age of 85.83. Among the top 10 are Macau, Japan, Switzerland, Singapore, Italy, South Korea, Spain, Malta, and Australia. The country which is having the lowest life expectancy is Chad, with an average age of 53.68. The life expectancy of humans has changed significantly over time, and this change has been influenced by a combination of factors, including advancements in medicine, public health, nutrition, sanitation, and lifestyle. In prehistoric and ancient times, life expectancy was relatively low. Many individuals did not survive childhood due to high rates of infectious diseases, malnutrition, and limited access to medical care. On average, between 57 and 67% of children in hunter-gatherer societies lived to be 15 years old. Only 79% of those 15-year-olds lived to be 45. Those who continue to live above 45 years could anticipate living until they were 65 to 70. Given the significant child mortality in these societies, it's clear that the life expectancy at birth was exceedingly low. The feudal and slave civilizations, which were based on class, appear to have been worse. During the medieval and Renaissance periods also, life expectancy remained relatively low. The lack of sanitation, inadequate healthcare, and ongoing conflicts contributed to high mortality rates. The average medieval peasant's life expectancy was just 35 years old at birth. But for those who survived past the age of 15, it was closer to 50 years. There's no question that once science was applied to cleanliness, sewage, human anatomy, improved nutrition, etc., life expectancy on average increased significantly. Of course, there were significant disparities between rich and poor in terms of life expectancy and class systems. Then life expectancy began to slowly increase in the 18th and 19th centuries, particularly in some industrialized European countries. Advances in agriculture and nutrition, along with improvements in sanitation, contributed to reduced mortality rates. The 20th century saw significant advancements in medicine, public health, and healthcare infrastructure. These developments, including the discovery of antibiotics, vaccines, and improvements in surgical techniques, led to dramatic increases in life expectancy in many parts of the world. By the mid-20th century, life expectancy had risen to around 60 to 70 years in many developed countries. Life expectancy continued to increase into the 21st century. Advances in medical technology, disease prevention, and healthcare access have allowed people to live longer, healthier lives. In some countries, life expectancy surpassed 80 years, and in a few regions, even higher. World Health Organization has confirmed the trend for longevity through research, and agreed that lifespans are getting longer. If you're a person who loves to read, then this request is for you to check the link in the description. Once you got the book in your hand, don't forget to give us your valuable comment. Between 2000 and 2019, the average life expectancy grew by more than 6 years, from 66.8 years in 2000 to 73.4 years in 2019. Despite the fact that healthy life expectancy, or HALE, improved by 8% from 58.3 in 2000 to 63.7 in 2019, this was owing to a falling mortality rate rather than a decline in years spent in handicap. In other words, despite a rise in HALE, which is 5.4 years, the rise in life expectancy, which is 6.6 years, has not kept up. Factors such as vaccination programs to reduce the prevalence of infectious diseases, improving maternal and child health care to reduce infant mortality, having safer food and water supplies, advancements in surgery and medical treatments for chronic conditions, lifestyle changes such as reduced smoking rates and increased awareness of healthy habits, and increased access to education and information about health and wellness have contributed to the increase of life expectancy over the years. It's important to note that while life expectancy is a useful measure regarding the overall health of a society, it does not predict an individual's specific lifespan. Many factors, including genetics and personal choices, can cause individual lifespans to vary significantly from the average life expectancy of a population. Even though life expectancy is generally increased worldwide, there are still significant disparities within and between countries. Factors like income inequality, access to healthcare, and social determinants of health can influence life expectancy. While some regions have made remarkable progress in increasing life expectancy, others continue to face significant obstacles that limit the length and quality of life. Let us now look into some of the key issues related to human life expectancy around the world. Global disparities. There are substantial disparities in life expectancy between different regions and countries. High-income countries generally have higher life expectancies than low- and middle-income countries. Sub-Saharan Africa, in particular, faces some of the lowest life expectancies due to a higher burden of infectious diseases, malnutrition, and limited access to healthcare. Infectious diseases. In many low-income countries, infectious diseases such as malaria, HIV and AIDS, tuberculosis, and diarrheal diseases continue to have a significant impact on life expectancy. Lack of access to healthcare, vaccinations, and medications contribute to higher mortality rates from these diseases. Maternal and child mortality. High rates of maternal and child mortality are a concern in some regions. Limited access to prenatal care, skilled birth attendants, and healthcare facilities contribute to higher mortality rates among mothers and infants. Chronic diseases. In high-income countries and some middle-income countries, chronic diseases like cardiovascular disease, cancer, diabetes, and respiratory conditions are leading causes of death. Lifestyle factors such as poor diet, lack of physical activity, smoking, and excessive alcohol consumption contribute to the prevalence of these diseases. Access to healthcare. Disparities in access to healthcare services persist within and between countries. Lack of healthcare infrastructure, healthcare workforce shortages, and financial barriers can limit people's ability to receive necessary medical care and preventative services. Not only the access, but also the inequality of quality healthcare affects life expectancy. Certain populations, such as racial and ethnic minorities, may receive lower quality care and experience worse health outcomes. Social determinants of health. Factors like income inequality, education, employment opportunities, and social support networks have a profound impact on life expectancy. People in disadvantaged socioeconomic conditions often face greater health risks and barriers to healthcare access. Climate change and environmental factors. Climate change can exacerbate health issues, including the spread of vector-borne diseases, heat-related illnesses, and food and water scarcity, which can impact life expectancy, particularly in vulnerable regions. Global health pandemics. Global health crises, such as the COVID-19 pandemic, can have a significant impact on life expectancy and health systems worldwide. The pandemic highlighted the importance of strong healthcare infrastructure, access to vaccines, and global collaboration in addressing public health challenges. One of the main issues that affected life expectancy around the globe is the COVID-19 pandemic. After the pandemic, the average lifespan decreased globally. Between 2019 and 2020, the decrease was 0.92 years, and between 2020 and 2021, it was 0.72 years. Yet the decrease appears to have come to a halt in the final 3 months of 2021. Despite the lack of clarity on its precise amount, this marks the first drop in the world's life expectancy since 1950, the first year for which a worldwide estimate is available from the UN. Before the end of 2021, life expectancy decreases appear to have exceeded 2 years on an annual basis. Only a few places since 1950 have seen annual decreases of that size, including Cambodia in the 1970s, Rwanda in the 90s, and perhaps several sub-Saharan African countries during the height of the HIV/AIDS pandemic. Now we know what the issues of life expectancy around the globe are, and let's complete it by reasoning why the life expectancy is an important indicator of human development. Life expectancy directly measures how long individuals in a population can expect to live on average. A higher life expectancy indicates better health outcomes and lower mortality rates, which are fundamental aspects of human well-being. Higher life expectancy is often associated with better access to healthcare services, including preventative care, treatment of diseases, and maternal and child health care. Life expectancy can be influenced by social and cultural factors, including healthcare practices, family support systems, and community cohesion. Addressing these factors can enhance overall human development. It also allows for comparisons of human development across countries and regions, and is a widely recognized metric used in the Human Development Index, which assesses and ranks countries based on factors like life expectancy, education, and per capita income. Life expectancy serves as a valuable indicator of human development because it reflects not only the length of life, but also the quality of life and the factors that contribute to well-being. Policies and interventions aimed at improving life expectancy often have a positive ripple effect on other dimensions of human development, making it a key measurement in assessing the progress of societies and nations.